Okay, everybody, welcome back. This video is going to focus on bloody urine, inappropriate urination, straining to urinate, basically generic urinary signs that you'll see in your dog and cat. And we're going to talk about it in a way that doctors usually do or should be thinking about this condition in dogs and cats. So with any diagnosis, you want to figure out anatomically where the problem is. So in the urinary system, if you're having urinary type signs, you have to think about it in terms of upper urinary tract and lower urinary tract. The upper urinary tract make up the kidneys, which there are two, a left and a right in normal animals, and then the ureters. The ureters are tiny tubes, conduits, that will carry urine from the kidneys to the urinary bladder. So kidneys, and each kidney has one ureter that goes down to the urinary bladder. The lower urinary system is made up of the urinary bladder, we all know what that is, which then transitions to a urethra, which is the conduit for urine from the urinary bladder out towards the external environment. So the urinary bladder and urethra out to the vagina or penis. And that would be consistent of the lower urinary tract. So if you have urinary signs, typically the veterinarian is trying to figure out, are these signs coming from the upper urinary tract or the lower urinary tract? Now, there's a broader factor that you have to also consider as well, where you may have a normal urinary system, so normal kidneys, normal ureters, normal urinary bladder, and normal urethra, but there's something else wrong with the body that's manifesting itself as a urinary issue. So for example, let's say the patient had exposure to rodenticide, rat poisoning, which depending on the rat poisoning type, that can cause a bleeding disorder, a coagulopathy we call it. Well, that may manifest itself as bloody urine. In that scenario, the urinary system is actually normal. It's the body that's having a bleeding disorder problem that is manifesting itself by way of the urinary system. So you have to not just think of the urinary problem as being upper versus lower urinary system, but really broadly speaking, it should be, is it a systemic problem, so somewhere else in the body, or is it a local problem, being the urinary system? And the urinary system is then divided into upper and lower urinary tract. And that should be the mentality that goes through this. The majority of folks, of course, if their pet has, let's say, bloody urine or inappropriate urination, et cetera, they immediately think about urinary tract infections. The reason why that is because urinary tract infections are so common, whereas the more systemic causes of urinary discoloration, let's say, are not as common, relatively speaking. So most folks will look at a patient that's got urinary issues and think, is this a UTI, a urinary tract infection? But we should think about it more openly and think, okay, is it a systemic problem or a local problem? And if it's a local problem, is it upper or lower urinary tract? And the tests are meant to figure this stuff out. And excluding other factors, there are a battery of tests that we can perform, diagnostic tools that we have that can help diagnose the patient, implement treatment, figure out a prognosis, and then go from there. And so that's how we should be thinking about urinary disease in animals, irrelevant of the fact that more common conditions are things like urinary tract infections or bladder stones or bladder crystals or kidney disease, etc., kidney failure rather, and the less common things are less common. And so we really should be focusing first on the anatomical location of the problem. Where is the problem exactly? Have diagnostic tools, tests that will determine that, and then from there you implement a discussion with the pet owner about prognosis, treatment options, etc. So I hope that helps everybody figure this out. It's a very common issue that we see on vet triage, telemedicine service. So I just wanted to share this hopefully helpful guide to folks who don't really know how to think about or have never really had a reason to think about urinary disease in this manner. That's how I want everybody thinking about urinary tract disease in general. So we'll see you in the next video. Please share, subscribe, like, do all the things. Thank you. Dr. Rafich from Vet Triage.